I would say HealthNet is all about community. HealthNet is an organization that's been around for 50 years. And we do a lot for the community. We see patients, we deliver babies, we see kids, we see adults. We have dental programs, we have behavioral health programs. We take care of the whole person, and we've been around for 50 years now. We are so excited and proud of the work that we have done.
My experience with HealthNet, and I think this has happened all over the city. Back in the 60s, there were lots of areas in our city that did not have healthcare access at all. My neighborhood that I grew up in being one of them. And so I originally came to HealthNet through Southwest Health Center Board. And it was a group of neighbors. My grandmother was one of them. And they realized that we didn't have healthcare in our neighborhood. And so they found a building that would work as a health center. And so they started having yard sales and fish fries, and eventually they would have a carnival at our local park and anything that they could do to raise money. And so the community just came together and through a variety of ways raised money and opened a health center.
We're such a caring, collaborative wraparound services. We're treating medical needs, and we're connecting to primary health care. We're connecting people to affordable housing that's safe for them, trying to get them up off the streets and trying to connect them to those resources that's going to help them in their crisis situation.
When I think of community, I think of family. I think of togetherness. I think of making sure that everybody within a certain area they're all working towards the same goal.
Both my husband and I are HealthNet clients, and we love the doctors there. Because I'm in the same building as one of our health centers, it is very likely that I can go in the morning with some ailment of mine, and I'm able to get in pretty quickly, if not that day, by the next day, to see my primary care doctor. I spoke so highly of it that my husband, when his doctor retired, also started coming to HealthNet, and we're both very pleased with the care of our doctor, the fact that he talks to us, he gives us options. It isn't just coming in, looking at you and leaving and letting the nurses take care of you. He really talks with you.
We really get to make patient access what it needs to be to meet the need of those in need.
We do take care of individuals who otherwise would not be able to receive care. Not because there aren't people who are willing to take care of them, but there's a lot of bureaucratic red tape and insurers and things like that, and lack of insurance that prevents some people from receiving needed services. Also, there's been distrust among certain communities when it comes to the practice of medicine. And so being in a community health center allows us to reach out directly into our community and to build a rapport and to establish relationships, long-term relationships with our patients. And again, we don't turn anyone away. And that is not like every practice throughout the country. I'm not saying it's right or it's wrong, it just is.
Early childhood development is important because we are building humans, basically. We are helping children. There's a large piece of infancy brain development that goes on even in the prenatal stage. So getting into families' homes and helping them eat better, to prenatally bond with their children, to basically reduce those stresses in their lives, have good birth outcomes for that family.
We should provide services that at this organization that we could be proud of and could use those services ourselves, whether it's for our clients. It should also, if it's good enough for them, it should be good enough for us.
I look back at the past and I think what's ahead of us, it's awesome. I can see us growing, enormously. I'm looking forward to another 50 years celebration in the future.
I've had patients that are victims of domestic violence. They're coming in missing teeth. And then, I've had a patient take off her sweater and show me the bruises down her arms. So because of all the resources that we have here available to us at HealthNet, I'm able to not just fix the broken tooth and make the smile better, but to help her get help to get out of that abusive situation.
I think HealthNet's integrated care approach is to me, one of the unique opportunities from HealthNet, meaning that we work so closely with our medical providers, with our psychiatric providers, with all staff, and being able to have a very cohesive and supportive approach to our patients so that everything can be here and they don't have to go to all these different places to get help, and that I think is such a meaningful opportunity for our patients.
What excites me about the future of HealthNet? One, the mission is unchanged, now more than ever. Two, HealthNet continues to grow, even after 50 years. Three, HealthNet is exceedingly relevant, still impacting people's lives. And four, HealthNet is still really important to the communities and important to the city. And so I look forward with great anticipation to watching HealthNet continue to grow and continue to contribute to the neighborhoods and to the city of Indianapolis.